If you win the nomination, you're going to face Tim Griffin in the fall. He's the GOP nominee. That was settled on Tuesday, May 18th. He's going to try to paint either one of you as a progressive or a liberal. He's going to paint himself as more conservative than you guys. And so I want to hear from you both what you think you are progressive and liberal on. And I'm going to ask you a conservative question too, but let's stick with the progressive and the liberal first. What's a position that you think you hold that is progressive and liberal?
Well, I think ironically, in light of the primary debate that we got into over health care, that's really the area that I have led as Speaker of the House. It's really my signature accomplishment as Speaker, the major health care initiative that we passed in the legislature in 2009. We had to take on big tobacco. They spent $1 million and brought in Dick Armey to lobby against the legislation that we had, and it provided $86 million for health care programs, provided a statewide trauma system that will save hundreds of Arkansas lives, kept community health centers open, provided funding for Our Kids First, and added thousands of children there, and then also provided a big infusion of funding for Medicaid, which was sorely needed in this tough economy. So, when you take that tough position and then really have to get Republicans to cross over, we had to have 6 Republicans cross over and vote for that package. That, to me, is a very progressive thing to do in the state of Arkansas, to take that kind of stand. And it's something that, regardless of how this works out, that I'll always have as an accomplishment and can be proud of.
How about you, Joyce?
I think on a number of things, I've been very progressive. And of course, I'm well known for the work I've done for education, through the years in the state. But there've been some very progressive things, like getting us out of the Lakeview lawsuit. I was fortunate to be able to have a leading role in that effort, and making sure that we've got advanced placement classes for students all over the state, and the work that we did with the early childhood education that we didn't have to do, but we did it because it was the progressive thing to do. That was not mandated. And the work I've done in the areas of health care with colorectal screening and getting a progressive policy in place to allow state workers to be able to have time off in case they are an organ donor. A lot of states don't do that. And having been an organ donor, a kidney donor to my sister personally, I knew what that meant. And so I was able to use that. And then I think maybe thirdly, I have been a champion for all my life in public service, working for working families and trying to make sure that people have a wage that is one that can take care of their families. But at the same time, not losing focus of we've got to have business for workers to have a job. And traditionally, we've not thought a great deal about workers having rights in the workplace, and that's a good thing. But it doesn't mean that the pendulum should swing their way totally. So,
well, let's shift to conservative, because I do want to give you guys a chance to point out where you may be conservative on some things. And I'm going to take budgeting off the table, because that's an easy one for you guys. It's a layup. The Revenue Stabilization Act kind of forces you to be that way in the legislature. But so maybe outside of a particular state budget issue, where do you see yourself as being conservative on a particular position or issue?
Well, it started in 2003. I have worked a great deal to support businesses. That's something that seems to be not very well known, not talked about very much. But it started in 2003. I was very supportive of a bill that was set forth by Senators Bryles and Representative Danny Ferguson. And it laid the groundwork for where we are now to give incentives and to give certain advantages to businesses who want to locate in our state. And of course, that really did help us when it came to the session of 2007, and we had an opportunity to put the quick action closing in place. And then, of course, I was happy to continue to support that. I was not there in 2007, but to support it in 2009. And I think that the insistence that I've taken about it's time to get out of court in Pulaski County, the Pulaski County school districts, because that's a lot of money that's going to a county where I live. But I think the conservative thing I've done there is say, look, we've got to get this together and quit draining money from other parts of the state. And that's not made everybody happy right in my district and in my county, but I feel strongly about that because it's a fiscal issue after a while. We have to get our house in order and do the right thing by education. We can't continue to have that much money come into one place when we can find our way out of a lawsuit, just as we did with Lakeview.
How about you, Robbie? What are you conservative on
Well,
besides budget?
I'm sorry you've taken budgeting off the table, because that's really something that I've been a hawk on as a member of the Faulkner County Quorum Court and the state legislature. I just don't think we should be borrowing money we don't know how to pay back or spending money we don't have, and I think Washington could learn a lot from Arkansas. But outside of that, although it is related to budget, is tax policy. In 2007, I was part of the leadership team that helped bring about the largest tax cut in Arkansas history. In 2009, when every other state in the nation seemed to be raising taxes just to balance their budget, we actually had a net tax cut, even after the health care program. We cut taxes here in Arkansas. That's something that I think sends a clear message to the people of this district as to my priorities related to their pocketbook. I do think I probably shade a little more moderate to conservative when it comes to issues like abortion, for instance. I voted against or voted for rather the bill that banned partial birth abortion in Arkansas. I voted for a bill that requires a doctor to inform a underage girl's parents before an abortion is performed. Those are just common sense things to me. As the father of two daughters, a doctor can't, or my daughter's school nurse can't give her an aspirin without my written permission. So why would I want a doctor performing any medical procedure on my underage daughter without my even knowing about it? So those are a couple of things.
Mm-hmm.